technical terms and stuff. They just say it like a real person.
WSIC News Talk Now.
Hello all, and welcome to the L Show on this beautiful Friday, where the L Show is standing for leaning in. We are not shying away from any topic that is important to myself and millions of other women as we transition through one of the most dynamic times in our lives, and that is menopause. The things that we go through, both mentally and the physical changes to our bodies, are not always comfortable topics for people to hear, but that doesn't matter because, we're going to talk about it. And for the entire month of August, we are focusing on loving the skin that we are in, no matter how mature that skin is or where that skin is. So to all my listeners, we are so excited today, and you should be as well, because not only do we have an awesome topic of discussion today, I would like to invite you to call into the show today to play some skin trivia in our last segment for a chance to win a prize from my boutique that includes an at-home microneedling device along with an elegant anti-aging serum that you will find nowhere else. This prize is valued at greater than $150. The lines will be open at 3:40, and we will take the first 3 callers. The number to the studio is 877-STUDIO-4 or 877-788-3464, and call in and let us know that you're calling to play some skin trivia, and we will have you on the air. For those of you who are new to our show, I'm your host, Dr. Nicole Eastman, and I'm the owner of Rose Pharmacy and Boutique Apothecary located here in Cornelius, where our focus is on functional medicine. My team and I, we actually make medications based on your provider's prescription that we formulate specifically for you. We also provide holistic alternatives like supplements, vitamins, and skincare, and much, much more. You can find out more about me in my store on roserxboutique.com or on Instagram and Facebook at Rose Pharmacy and Boutique Apothecary. My guest co-host today is Suzie Baker, who is an esthetician at Lake Norman Skin and Laser that's now owned by Renew Health and Wellness, right?
Yes.
Here in Cornelius, and that's such a beautiful and timely addition. They're able to meet more of their clients' needs, right?
Absolutely.
So Suzie, tell our listeners about your background and what you do at Lake Norman Skin and Laser.
Sure. So I'm a medical esthetician. So we do all the more on the laser side of anti-aging. We do a lot of facials and peels and fun stuff like that as well. I got my undergrad from UNC Charlotte in 2010, and I was office manager for a plastic surgeon. And while it's fun talking about skin, touching it's a little bit more fun. So decided to go back in 2015 and got my license.
Gotcha. So your website is, what's the website?
We're lknskinandlaser.com, and then you can find us on Facebook and Instagram at LKN Skin and Laser.
Awesome. Well, welcome,
Thank
Suzie.
you. So excited to be here. Thanks
on
for
the
having
show. No problem. We're glad to have you here. So for the past few weeks, we have, within our skin series, been talking through the skin, and we've taken an inside-out approach, layering those little internal puzzle pieces that are essential in order for you to look your best. We've talked about gut health. We've talked about the foods that we put in our bodies. We talked about hormonal balancing if it was needed, and also some alternative therapies like IV, exciting therapies like peptides. We talked about some external practices too, like, our skincare regimens. We talked through cleansers, creams, and the popular anti-aging ingredients that we hear about as well.
Fun stuff.
And of course, we talked about the importance of sunscreen.
Yes.
Cannot talk about that more. Okay, so all right, so I do want to remind our listeners that this content may not be suitable for all audiences, and as always, the information presented in the show is not intended to replace or take away the advice of your healthcare provider. Now, today, we're going to get down to those non-surgical procedures that can help us look younger, and because what we're seeing has a direct effect on our emotions, it's also going to help us feel better.
Absolutely.
And that is not always just the skin on our face. So we will talk about that. Again, I note that the content may not be suitable for all audiences. So Suzie, questions. What are those conversations like when you sit down with a client to discuss the procedures that they're interested in?
So I like to have my clients come into the office to do consultations. I know we can do them online over Zoom, and with all the new COVID stuff, kind of learn how to do more things over Zoom. But I prefer to have someone come in. I'll have her come in on the table, double cleanse her face, and really get my hands on there to really be able to look and feel at the same time. And then we also have a Visia skin scanner in the office. And what that guy does is we'll cleanse your skin, and then it takes a 3-way photo of your face. And it also gives me a subdermal idea of the sun damage is under your skin, where capillaries are, little busted capillaries or things that might come to the surface. Rosacea, you can really see where that is, and kind of map out melasma issues that way. Yeah, it's really neat. It's fun.
Wow. Okay. So then, like, do you have people that come in and, you know, as far as expectations are concerned, they come in and they're like, this is what I want.
And then sometimes it's not the right thing.
Right.
Yeah, I always try to set expectations, make sure we are being realistic. We all want to look like J-Lo, but
exactly.
But J-Lo doesn't even look like J-Lo. I mean, the filters these days are a little amazing, frightening, but amazing.
Facts. I mean, I'll be like, girl, I want to look like I was just born. Is there any way you can do that for me? Yeah.
Well, we can certainly try. I just try to tell people that, you know, I don't need to look 16. I just want to look well rested. Like I had great night's sleep and just bright.
Right. Yeah. Well, I'll say this. So I think that it is very important to note that a mindset of self-acceptance is so important when you are going into one of these procedures. It's okay to age, and
it's a
okay.
gift.
Yeah, and it's exactly. And it's okay to want your skin to look healthier by going through some sort of procedure. But I think the point here is that when you are in that mental space of self-love and acceptance, the beautiful energy and the vibrations that you are projecting out in the universe, what you get in return, and when you do have that procedure, is just enhancing the already beautiful, vibrant, gorgeous you.
A happy girl is the prettiest,
right? without some of the wrinkles, without some of the fine lines and spots and damage.
Absolutely.
Right? So I think it's super important at this stage in our lives to make sure our mental game is where it needs to be. Nothing wrong with going to get these procedures.
Right.
Nothing at all.
If it makes you feel good about yourself.
Absolutely. And that's what the game. That's what the name of the game is. Yes. So I always like to start with some fun facts. So since 2000, there has been a 6% decline in the number of invasive plastic surgical procedures. I think that's interesting because there's been a corresponding increase, 180% of non-surgical, like minimally invasive procedures. So that just lets you know that that's becoming much more popular, easier for all the reasons that we know.
Downtime,
right?
all the things.
Exactly. And then the top 3 non-invasive procedures, and this is according to the American Society of Plastic Surgery, are Botox, fillers, and peels in that order. I'm like, that's interesting, very interesting. And we will be talking about all 3 of those today.
All 3 things with minimal downtime.
Exactly. So, again, you know, what we're trying to do is educate people, let them know what options are, the experiences, all of that, so that you can make, of course, informed decisions along with your practitioner for what's best for you.
Absolutely.
Right? So, again, if you have questions concerning a certain procedure, you can always call Lake Norman Skin Living.
Please call me.
Absolutely.
Happy to help you.
When we come back, we are going to dive right into options that do not include having a surgical procedure. See you when you're back.
The Elle Show with Dr. Nicole Eastman, owner of Rose Pharmacy and Boutique, will return after this short break on WSIC.
Here's your WSIC community calendar. Asheville native Kanan Cox will be performing at Kane Center for the Arts Friday, August 25th. Show starts at 8 p.m. Kane Center for the Arts 2024 Fall Season. Buy your tickets now at kanearts.org. That's CAIN arts.org. primal.org. Happy birthday, Huntersville! Celebrate Huntersville's 150th birthday this Saturday. Primal in Huntersville will have live music, food trucks, and special deals all day on August 26th. Huntersville is 150 years old, and you should celebrate at Primal off of Highway 115 in Huntersville. It is one of the last couple of weeks to enjoy open swim at the Kerrigan Farms Quarry. Thursday, August 31st is the end of the swim season at Kerrigan Farms Quarry. Swim up an appetite with the whole family and enjoy Kerrigan Farms Farm-to-Table Restaurant. Kerrigan Farms open swim at the quarry. Enjoy it before the end of August. Love cycling? Love supporting veterans? Purple Heart Homes presents Take That Hill. Sign-ups are open now. The event is Saturday, October 7th. It is a great way to support a local organization focused on veterans. Take That Hill, presented by Purple Heart Homes. For more info, visit bikesignup.com. Eli Yacinth Band is playing this Friday, August 25th, at the Upper Room in downtown Statesville. Enjoy a great show with a full 9-person band. Have a full night of jazz music with the Eli Yacinth Band, Friday night at the Upper Room in downtown Statesville. Have an event you'd like to tell people about? Yard sales, estate sales, and everything in between? Visit WSICnews.com and click on events to submit your event today.
I'm Nick Rice with your WSIC forecast. As we head through the rest of the afternoon, it's going to stay sunny with a high of 94, heat index of 102. Tonight, slight chance of showers and thunderstorms before midnight. Look for partly cloudy skies and a low of 73 in the morning. On Saturday, patchy fog will be around before 8. Otherwise, it's going to be sunny and hot. I'm Nick Rice from WSIC's Weather Center.
Breaking the silence and shattering the stereotypes surrounding women aging. It's The Elle Show with Dr. Nicole Eastman on WSIC.
Be a part of the conversation.
We can't fix America's debt by starving its people.
Have your say.
One shooting after another, and we're doing nothing to solve it?
This is WSIC. News, talk, now.
Welcome back to the Elle Show. I am Dr. Nicole Eastman, and I am here with my co-host, Suzie Baker, who is an esthetician at Lake Norman Skin and Laser, where every day she is performing these non-invasive procedures. So who better to have on the show? I want to remind our listeners to call in at 3:40, where we will allow the first 3 to play some skin trivia for a chance to win an awesome prize valued at greater than $150. Call the studio at 1-877-STUDIO-4 or 877-788-3464. So now let's just jump right into one of my favorite procedure topics other than microneedling, and that topic is peels.
Woo.
I had a chemical peel done, and my skin looked so amazing. And I believe I was telling you about this. It was a peel that doesn't peel. It was amazing. So my skin was
the
like,
no peel.
Yeah, it was bright. It was dewy. I mean, just youthful. The results were amazing. And I didn't even really try to go and get anything done. I just really wanted to, have the experience because skincare is a major focus of my business.
And I think the misconception with peels is that it's going to peel. The
Right.
word peel, we think that we're going to look frightening with
Yes.
all the peeling. And
Yeah,
that's
like a lizard.
not necessarily true.
No, didn't happen. Didn't happen at all. I'm like, this is amazing. And I think about it, like I make peels. I make the creams that go along with the peels. I do all of this stuff, but I had never had one. So I'm like, you know what? Let me just get this done. And it was a great experience. So Suzie, I want you to explain to our listeners what a chemical peel is.
Sure. So after age 25, unfortunately, our collagen starts to slow down, and it gets a little slower and slower every year as we age. So what a chemical peel is going to do is stimulate collagen. So it's, for lack of better words, it's a controlled burn, I guess. So you trick your skin into thinking that it's been injured, that you've been in some, like a house fire or something. And then it springs to action, bringing all that collagen all fresh, sloughing off dead skin cells, getting rid of all that cellular trash that's kind of stuck there hanging out. And all those fun cells come up to the surface.
So I think it's interesting though. Like I love the process of the peel, But I think that people don't think, depending upon what kind of peel we're going to get, right? I don't think people think about how we prepare our skin for the peel. And although people don't do it who should do it, because of the time involved, I mean, my recommendation is always like around 4 weeks, depending upon what sort of peel they're getting, around 4 weeks, just to prep the skin, right?
For sure.
So, and really, like, I think about like some of the prep kits that I make that have like tretinoin in it, you know, something to help with some skin turnover, hydroquinone, you know, to help brighten and homogenize.
Right.
You know,
and
the
then
skin.
that also helps, the hydroquinone will help the tyronidase in your skin, which can accidentally give you a sunspot. So you want to calm that down.
Yes.
So that
yes,
HQ
yes,
will
yes.
help that just make the peel safer, just makes everything safer.
Exactly.
And better.
Exactly. So we're trying to get the best results for you.
Absolutely.
Right? So we want to do whatever we need to do to make sure that when we apply the peel, that you're going to get
It gets all the way in there, it does its job.
Exactly. So tell me also, like, what are the different types of peels that you work with?
There are so many different types of peels. So you can do, like you said, the no peel where you get very minimal peeling. You can go a little bit deeper than that, where you get a light on the surface, like a sloughing. You'll have like just a little bit of flakiness, almost like you had a dry skin and a sunburn. And then you can go very deep. You can get very deep peels where you're getting into like your phenol peels, which is a little bit wild, and then your jasmine peels, things like that.
Gotcha.
So many different levels, and it's very easy to customize.
Well, let me ask you this question. Like, what are some of the concerns, though, that peels typically address? Like, why are people coming in to get peels?
A little bit of everything. I do a lot of peels for acne. Acne is a very popular reason to do a chemical peel, because there's a lot of reasons why your skin, if you're getting clogged, that a peel could help with that, sloughing off that. And then just pigment and fine lines and wrinkles, so much. Melasma, I do a lot of superficial peels for melasma. That's a skin condition where you get almost like a dark island on your face. So it's not regular looking sunspot. It's more like a little islands that you get.
Yeah.
It's hard to describe, I guess.
Yes.
People call it the pregnancy mask.
Yeah. And I think that like everyone has seen it, but they don't know that is what it that's what it was.
Yeah.
And people have the blotches on their skin.
Right.
That's what we look at. That's melasma.
Right. And a nice light peel is the way to go with those.
So what are like some considerations as well? So when we're thinking about the peel, like certain factors based upon a client, like are we looking like what their skin looks like, the pigment of their skin already,
Yes,
things like
the
that?
condition of your skin, that would definitely dictate what type of peel that I would choose. Your skin pigment. So on the Fitzpatrick skin scale, we go 1 to 6, 1 being red-haired and 6 being the darkest. So that would be, you have to be very careful what you choose so you don't hurt someone. Yeah.
Right. Okay. So for someone who has lighter skin, you know, are they more prone to scarring, or are they more prone to, how's that like?
It's a lot, honestly, doing chemical peels on someone with a lot lighter skin is a little easier.
Okay.
Because it's a little bit harder to hurt that person. Someone with more melanin is going to have more reactive skin. It's a little bit, I tell my clients it's like a tulip petal. Their skin's so delicate.
Right.
So you have to err on the side of caution. And that's where your prep kit comes in. That it's, I almost don't want to do a chemical peel without a prep kit when your skin type's 4 and higher.
Gotcha. What about like the oil in someone's skin? Like, are we considering that as well?
Absolutely. If someone has more oily skin, you're going to have to go a little bit heavier with that peel. So before you apply the peel, you'll use a little bit of a prep solution to help wipe away that oil so it won't dilute the peel.
Gotcha. Okay. So what about peels on other parts of your body?
Well, you can pretty much do a peel anywhere these days. All peels, like we said, are different, but there's certain ones. Face, right? Okay. Absolutely. One that I do kind of often is for underarms.
Okay.
That's gotten very popular. When we have hormone issues sometimes and just friction issues, we will get a little bit of pigment in our vaginal area. We can get pigment there, and then in our underarms. Okay. And previously, that wasn't something that you really could treat. You could go and work on your hormones, clearly, but there's a chemical peel for that.
So as we talk about those sensitive areas.
Yes, sensitive.
So like your vagina, right? So we don't talk about it, but this is real. This is real. As we age, we know the skin.
It changes everywhere. It changes everywhere.
There's no discrimination, right? So, and these things really, they can affect your quality of life.
Yes.
You know, the intimacy with your partner, the way that you feel about intimacy, the way you feel about yourself. So tell our listeners 2 of the procedures that are all geared towards helping our vagina.
All right.
Yes.
So we're just going to go ahead and just use that word. Just throw it out there.
Yep. Real.
So the one for pigment would just be for that, for stimulating collagen externally and getting rid of that dark pigment, uneven pigment that we get. And then we have, we call it the vajacial.
Yes, and that's what it's called. I've never heard it called anything else.
I actually love that word. I think it is adorable.
Yep, absolutely.
So for the vajacial, we have it at home. It's called a carboxy therapy treatment.
Okay.
So it's like a gel. So you'll mix the 2 gels together at home, and they are activated when you mix them together. So you use it pretty much immediately right after you mix it.
Got it.
And it's internal and external, and it helps to stimulate blood flow, which helps with collagen, which helps with elasticity, and actually it also helps with dryness. So when we go through that menopause situation, there's a protocol of peels, of the mask that you can do, the carboxy mask on your vagina.
Gotcha.
And it works wonders. It's amazing. It's life-changing for a lot of women.
Okay. All right. So ladies, you hear that? You hear that? So what about there's a labial peel?
Yes.
Right?
That would be the one for the pigment.
Gotcha.
Yes.
Okay.
Yes.
So
love it.
how does that work? How many treatments?
That one, yes, that one's a little bit different too, because that one also comes in a protocol, but it's not as close together as the mask would be. So that one you want to do in a series of 3, spaced out by 3 to 4 weeks.
Okay.
And there's no, as odd as it sounds, there's no pain at all. Like you feel it going on. Maybe it's a little bit warm and tingly, but no pain. That's not like any of those really intense face peels we've had where we're just on fire.
Yeah. Right. Okay.
Yeah, it's actually quite comfortable. Yeah.
Wow. Okay. Again. I mean, this is the realness of our aging. But
yes,
we have.
And then sometimes if we wear our panties too tight or our pants too tight, that we can cause friction there, and that can also cause pigment. So that's something to think about.
Okay,
like,
ladies,
don't wear your undies so tight, girls.
Don't wear your pants so tight. Right?
Let your lady breathe.
Yeah. Exactly. So again, like this is real. This is real. So all right. So let's go back north of our bodies. And are there any things to watch out for or really stay away from when we are going to have the procedure done, or even right after we have the procedure?
Yes, definitely. So when we have a peel, I always tell people to work out that morning, get your workout over with, because I don't want you to sweat for 3 days after your peel.
Okay.
Because your sweat can get confused and not know how to make it out of your intercellular cement, and you could end up with weird little sweat bubbles on your face.
Yeah.
It's not cute, but it wouldn't be clearly permanent, but it's not fun. It's not fun. That's just 3 days of no sweating, no saunas. I definitely don't want you in the sunshine. That is a huge no-no, at least for 7 days. I want you to try and stay out of the direct sun. And then after that, you can go back to your regular sun protection, your hats and your sunscreen.
Gotcha. Okay. So what about, what's the time frame of getting a pill when you come in? Like, is it a 45-minute procedure? Is it an hour?
So we schedule ours for an hour.
Okay.
And we like to do a dermaplane for most people's skin before the peel. And that gets that dead skin off the surface. A dermaplane is basically a surgical blade that I take and just scrape off that top layer very delicately.
Okay.
And then when we do that, it makes the peel a little bit more intense, but also makes the downtime a little bit less. So that way you won't have as much dead skin visibly peeling off.
Gotcha.
Yes.
So, and how long do the results last for a peel?
So you want to, after about 48 hours, you'll start to get a little of the flaking will start. And you'll usually about 5 days for most of our peels of just flaking.
Okay.
And then you want to come in every 6 to 8 weeks in the fall and winter if you can, just to really stimulate that skin. It's harder to do in the spring and the summertime, clearly, because we're in the sunshine so much.
Okay.
Yeah.
Okay. All right.
So fall's your time.
Fall.
It's
fall
coming.
Is our
Yay.
time.
It's peel season.
So this is amazing. I love peels, guys. Love peels. So when we get back, though, we are going to jump into our next topic, and that is Botox and fillers.
Woo.
More of The Elle Show with Dr. Nicole Eastman, owner of Rose Pharmacy and Boutique. Straight ahead on WSIC.
Local news and weather now on the new 105.9, 100.7 WSIC. News Talk Now.
I'm Mike Jackson, WSIC News. Faced with an ongoing challenge that affects close to 20,000 Iredell County residents, the Iredell County Health Department and United Way of Iredell County are joining together to combat food insecurity to ensure everyone has access to food and knows where to find local resources. The website, iredellfood.org, is where you can go for all the details. And a man was found dead this morning in Johnston County after a hit and run on U.S. Highway 70. The State Highway Patrol is asking for the public's help to find the person or persons responsible. Around 1:20 a.m., the SHP said a man was hit by a car near U.S. 70 Business in Wilson's Mills. The SHP said the man appeared to have been run over by at least one vehicle, which did not stop. No arrests have been made. The investigation is ongoing. Now, sports with Joe Berg.
Tonight, the Carolina Panthers take on the Detroit Lions in the final preseason game of the year. And on Saturday night, NASCAR Cup Series action from Daytona for the final race of the regular season.
WSIC weather, another scorcher, sunny, hot 97 with a heat index at 104. Turning mostly cloudy overnight, a low of 73, then sunshine returns for Saturday, a high 95 and a heat index at 103. Mike Jackson, WSIC News.
I'm getting vaccinated with Prevnar 20.
So am I, because I'm at risk for pneumococcal pneumonia.
If you're 19 or older with chronic conditions like asthma, diabetes, COPD, or heart disease, or are 65 or older, you are at increased risk for pneumococcal pneumonia. Ask your doctor or pharmacist about Prevnar 20, pneumococcal 20-valent conjugate vaccine. It can help protect you against pneumococcal pneumonia in just one dose. Even if you've already been vaccinated with other pneumonia vaccines, Prevnar 20 may help provide added protection. Prevnar 20 is approved for adults to help prevent infections from 20 strains of the bacteria that cause pneumococcal pneumonia. Continued approval may depend on a supportive study. Don't get Prevnar 20 if you've had a severe allergic reaction to the vaccine or its ingredients. Adults with weakened immune systems may have a lower response to the vaccine. Side effects include pain and swelling at the injection site, fatigue, headache, muscle, and joint pain. For full prescribing information, please call 1-855-213-2138 or visit Prevnar20.com.
Discover credit cards automatically double all the cash back you earn at the end of your first year, which means... Wait, hold up. Question for the audio engineer.
Go ahead.
Did I read that right? Discover automatically doubles all your cash back?
Yeah, that's what the script says.
So if I get a Discover card right now, I can earn twice the cash back.
Apparently. Wait. Unlimited first-year cash back match. Only from Discover. See terms and learn more at discover.com/match.
Right now at Wendy's, when you buy either a Dave's Single, Spicy Chicken Sandwich, Medium Frosty, or 10-piece nuggets, you can get another for just $1. Your dollar never tasted so good. So it's obvious what everyone will get, right?
Definitely nugs
Spicy
and
chicken
a Frosty.
sandwich,
Dave's Single and a Frosty for me.
And a Frosty.
Okay, who said Frosty and a Frosty? Pick your obvious choice. Choose wisely. Choose Wendy's, buy one, get one for $1.
Limited time only. Price of participation may vary. U.S. Wendy's valid for item of equal or lesser value. Cannot be combined in a combo or any other offer.
The world's news.
Taiwan is a successful democracy, a thriving economy, and a global leader in health and science.
When you need it.
I was surprised there were no facts in there. I mean, normally in an indictment you have alleged facts, so they said that this was a false business record entry to aid and abet another crime. We're not saying what the other crime was.
This is WSIC.
I believe that the Biden administration should ignore this ruling. It is up to the Biden administration to choose whether or not to enforce such a ruling.
WSIC. News, talk, now.
Prioritizing your health is one of the best ways to take care of yourself. From routine visits to the joys of pregnancy to the illnesses that stop you in your tracks, Iredell Health System will be by your side. Learn more at iredellhealth.org.
Providing a safe space for women to talk about the physical and emotional changes they experience as they age. This is The Elle Show with Dr. Nicole Eastman.
Welcome back to the Elle Show. I am your host, Dr. Nicole Eastman, and I'm here with my co-host, Suzie Baker.
Hi there.
Suzie B, who is an esthetician at Lake Norman Skin and Laser, where every day she is performing these non-invasive procedures. I just want to remind our listeners again to call in at 3:40, where we are allowing the first 3 callers to play some skin trivia for a chance to win an awesome prize valued at greater than $150. And I want to make a correction really quickly. The number to the studio is 1-844 Studio 4. That's 1-844-788-3464. So let's jump into some Botox. Yes, so some Bobo. I love myself some Botox. I've had that done as well. Again, just to get the experience. And I'll tell you, the needles are they're super small.
Itty bitty.
Didn't require any sort of pain, numbing cream or anything like that. I was over pretty quickly. And according to the, American Society of, surgeons, that is the number one procedure. And I can understand why that would be.
So quick and easy.
It's quick, right?
Yeah.
So how does it work? How does Botox work?
Sure. So the way that Botox works is by temporarily basically making it so your nerves can't talk to your muscles.
Okay.
So that acetylcholine messenger goes to the muscle and the muscle can't hear it temporarily. So it's about 90 days. It's not forever. And then it just can't make that muscle move. So it's a temporary paralysis of the muscle.
Gotcha. So basically the muscle contraction that causes the frown or the wrinkles.
So the muscle is completely fine. It's not affected. It just can't hear that message.
Gotcha.
Yeah.
Got it. Okay. All right.
Just temporarily.
So there are different types, right? So different types of botulinum A toxin. So what are those?
There's quite a few different ones. The big front runners are your Botox, Xeomin, and Dysport.
Okay.
I'm actually kind of lately leaning towards Dysport for myself. It's supposed to be better for athletes when you work out a lot, and I like to cycle, so it seems to last a little bit longer. There's also a new one that's come out called Daxxify, and where those first three ones last around 90 days. The Daxxify is a plant-based that's supposed to last 6 to 9 months. So, but it's very new. One of those new ones out there.
Got you. So have you heard of how it's been going for people with that new one?
We don't have it just yet in our office, but I have quite a few friends that have it in their med spas, and they're loving it so far. So
gotcha.
I'm letting them try it first.
Yeah, I would just be nervous just if that long. Like I don't want to be the first one to the to the party.
I'll check back with you next year.
Yeah, exactly. Just to see how it goes. Exactly. So let's talk about some of the differences between them, with what they're used for.
Sure. So when you inject it into the muscles in the face, it's going to relax that muscle. So a lot of people get it very popular in your glabella, which is that little space in between your eyebrows.
The 11s?
The 11s there.
Yes.
So 111 or 111.
Yes.
And then around our eyes, also really popular for crow's feet there. Another thing we get a lot of is called the lip flip. And it's where she injects the Botox just above the lip line, so just usually about 5 units, and it will drop this muscle down just ever so slightly, and it gives the appearance of your upper lip being bigger. It's very pretty. Yeah.
Okay. Is that one painful? Is that one more
the little
painful?
Middle injection can be a little bit of a zinger, but like we said, it's just one little boop and then done. But we can also put numbing cream across the lip if we need to. Yeah, if you're a very sensitive little kitten, we can definitely do that.
Yes. So you had mentioned the differences in how long the old one lasts versus the new one. So we're talking about 3 months versus 6 months.
Yes.
And whatnot. Okay. So what about other uses for Botox? Because we hear that, of course, headaches and things like that.
Absolutely. Migraines, with the tension headaches
and whatnot. Exactly. So
there's actually some really neat new ones that have kind of. So I get a little bit in my jawline, so I don't grind my teeth.
So you're a teeth grinder.
I know. I'm so naughty.
Okay. Yes.
And it will elongate your face just ever so slightly. It's very elegant looking. So just get a little here and a little here. And then another new thing is getting the Botox in your trapezius muscle here in your shoulder.
Okay. Got it.
And what that does is we hunch over so much when we're sitting at our desk and typing. And
I'm hunched right now. Actually,
we both are. We got to sit up.
Okay. Yeah. Okay.
So we've all the texting. So we put it there, and it will relax this muscle. And sometimes people just have a more tense muscle there, just like genetically, and it relaxes that muscle and it kind of elongates the neck. It's pretty.
Gotcha.
And it feels neat. Like it feels very relaxed. In the shoulder area. Yeah.
Okay. So I think it's interesting though. When we first heard about Botox, everyone was super, super scared, right? Because of what it is.
Right.
But the fact, medicine is a beautiful thing, and that, we figure out ways to use it to benefit
absolutely
the masses. And this is just one of those ways. And it's the most popular, procedure that people are getting.
Because you can even use it for one of my baby cousins had a stroke in utero, and her little hand doesn't like to open. The little muscles are very tense there. So we will inject the Botox into the muscles in her hand so she can have more use of her hand.
That's amazing.
Right?
That's amazing. I love it.
Thank you, Botox.
Yeah, thank you, Bobo. And so we said no downtime, of course. And
the only thing you don't want to do is get super sweaty that day or touch it for 4 hours.
Okay.
You don't want to move it around. So you want to stay upright and I wouldn't do a facial after. You do a facial before.
Gotcha.
But then it's just 4 hours. So
okay. So and the reason why is because we want the Botox to stay where you inject
and it will.
And if you lay down or you do this, you could or you manipulate your face.
Yes, we don't want that sucker moving around.
Got it. Makes sense. Makes sense to me. Makes sense to me. We want it to do what it's supposed to do and where it's supposed to do it at. Right.
Absolutely.
All right. So let's get into fillers.
Yes.
So what are fillers? I know a little bit about fillers, not a whole lot, but just give me and the audience
so many
some more.
different.
So what's the main point? What's the main reason people get them?
To fill your skin.
Basically, the name says it all.
Right. It adds that volume back to your face. As we're aging, we're losing that volume. And then we'll get the deeper lines are harder to treat. So put a little filler in there, boop, pop that sucker right back out again. I know.
Okay. So do you get fillers in other places in your body, just your face, or is
around the face is really popular. The nasal labial folds around your mouth really popular, and the lips that's the most popular place that we inject.
Okay, so what are the different types of fillers?
There's so many different. There's so many out there now, and they all are for somewhere different. So like Voluma, for example, would be one that's injected a little bit differently. That one goes to your cheeks, and it'll last around 2 years. And then a completely different filler would be injected into the lips because they have a different feeling and they stay a different time frame versus others that dissolve faster. So it kind of just depends on your skin, your age, what you're looking to do, and that's how your provider would choose your filler.
Gotcha. And so the quantity of... So do we say, is there just a standard amount that we use?
There's a vial, and typically most people, like if you're doing the lips, you're going to be 1 full vial in your lips, kind of just depending. Yeah.
Got it. And I don't know, and you may have said this, what are we injecting into? What are we injecting?
It's a hyaluronic acid. You mean into your face?
Yes.
So it goes into the soft tissue in your face, but they're mostly hyaluronic acid fillers. Your skin is made of hyaluronic acid.
Right. Okay.
So it's kind of, I'd always describe it as your mattress. So if you have a mattress and there's springs and fluff in the mattress, right?
Yeah. Yep.
So the springs and the fluff is your collagen elastin, and I'm sorry, the springs is the collagen elastin, and the fluff is your hyaluronic acid. So that mattress is getting flatter as it ages, right? We want to puff it back up again. Put in a little hyaluronic.
That's a great analogy. That's a great analogy.
Thank you.
Because in my head, I'm thinking about that mattress, and I'm like, okay, it makes sense.
And as you're laying on, it just gets,
Yeah, as you're laying
you want a fluffy mattress.
Right, exactly. So what's the most popular filler for you guys?
Definitely the lips.
Okay.
Yes, very popular.
All right.
It's just so pretty, and it's so instant. You leave looking different with filler. It's amazing.
So how long does that procedure last?
So with the filler, we typically will do a little bit of numbing cream first. So we'll put that numbing cream on for about 20 minutes, and that way you don't feel the needle stick. A lot of the fillers have a lidocaine built into the actual filler. So once it goes in, you're not going to feel any of that. It's just an instant numb.
Got it.
You're in the office about 30, 45 minutes, something like that.
Okay, got you. So you got to sit
a little
around
longer than
for the
Botox, a 20-minute Botox appointment.
Versus, a little longer for this. Okay. And how long do fillers last?
Anywhere from around 6 months to sometimes the ones in the cheeks, those are 2 years, but there's some other ones that are more permanent that you can get up to about 10 years with. Like the Sculptras that you put in your temples, that kind of filler can last up to 10 years.
10 years?
So you better like it.
Whoa, that is crazy.
You want a stepstone up to that one.
Yes. Wow. All right, so when we get back, guys, we're gonna dive right into our trivia game with a few of our listeners for their chance to win an at-home microneedling device and a beautiful anti-aging serum. We will see you when we get back. Thanks.
More of The Elle Show with Dr. Nicole Eastman, owner of Rose Pharmacy and Boutique. Straight ahead on WSIC.
Here's your WSIC community calendar.
Asheville native Kanan Cox will be performing at Kane Center for the Arts Friday, August 25th. Show starts at 8 p.m. Kane Center for the Arts 2024 fall season. Buy your tickets now at kanearts.org. That's CAIN arts.org. Happy birthday, Huntersville! Celebrate Huntersville's 150th birthday this Saturday. Primal in Huntersville will have live music, food trucks, and special deals all day on August 26th. Huntersville is 150 years old, and you should celebrate at Primal off of Highway 115 in Huntersville. It is one of the last couple of weeks to enjoy open swim at the Kerrigan Farms Quarry. Thursday, August 31st is the end of the swim season at Kerrigan Farms Quarry. Swim up an appetite with the whole family and enjoy Kerrigan Farms Farm-to-Table Restaurant. Kerrigan Farms open swim at the quarry. Enjoy it before the end of August. Love cycling? Love supporting veterans? Purple Heart Homes presents Take That Hill. Sign-ups are open now. The event is Saturday, October 7th. It is a great way to support a local organization focused on veterans. Take That Hill, presented by Purple Heart Homes. For more info, visit bikesignup.com. Eli Yacinth Band is playing this Friday, August 25th at the Upper Room in downtown Statesville. Enjoy a great show with a full 9-person band. Have a full night of jazz music with the Eli Yacinth Band. Friday night at the Upper Room in downtown Statesville. Have an event you'd like to tell people about? Yard sales, estate sales, and everything in between? Visit WSICnews.com and click on events to submit your event today.
I'm Nick Rice with your WSIC forecast. As we head through the rest of the afternoon, it's going to stay sunny with a high of 94, heat index of 102. Tonight, slight chance of showers and thunderstorms before midnight. Look for partly cloudy skies and a low of 73 in the morning. On Saturday, patchy fog will be around before 8. Otherwise, it's going to be sunny and hot. I'm Nick Rice from WSIC's Weather Center.
In life, we plan for many important things. Weddings, our children's education, retirement. A celebration of life is really no different. Planning and paying for your life celebration in advance will give you and your family valuable peace of mind. We'll help you take care of every detail with professionalism and compassion. We're Bunch Johnson Funeral Home. Find us at DignityMemorial.com.
A platform that embraces the physical and emotional changes that women experience as they gracefully age. It's The Elle Show with Dr. Nicole Eastman.
Right. Done. Welcome back to The Elle Show, where we are about to jump into our first ever trivia. We're going to do some skin trivia. And it looks like I have a few people on the line. I have 3 people. I have Annette, I have Bria, and I have Natalia. So we want to go ahead and bring in Bria to the line.
Hi, Nicole.
Hi, Bria. Thank you for calling in to play some trivia.
Of course.
Wonderful. So let me explain to you the rules of the game. So I'm going to ask you 2 multiple choice questions and then an open-ended question where you have to fill in the blank. So if you've been listening to the show, you could get all these questions correct. If you haven't been, there's a chance that you're going to get the multiple choice questions correct, but the open-ended one could be a bit difficult. In order to win, you must get more questions correct than your competitor. And if there's a tie, I will do a tiebreaker question that is multiple choice, but it'll be a little more difficult. All right, so you understand the rules?
Yep, I'm ready.
Okay,
all right. You got this, Bria.
Yeah, exactly, girl. Here it
Rooting
goes.
for you.
All right, so 1. What is the correct order from greatest extent to least? Do these conditions affect the aging of your skin? A, smoking, sun, pollution. B, pollution, smoking, sun. C, sun, smoking, pollution. Or D, they all affect the skin the same.
I'm going to go with C. Sun is up first. That's why you always got to wear your sunscreen.
Yes, good job. All right.
Yay.
Okay.
Good girl.
All right. So the next question, if we want to fix the skin, we should start by fixing A, your hormone levels, B, the health of your gut, C, your sugar intake, or D, your water intake.
Ooh, that's a hard one. I like it.
Let's see.
Only because I've been listening to the show, I'm
Yes.
going to go with gut.
There it is.
Ding, ding,
Good
ding.
job. Good job. Okay, wonderful. Okay, and so what is the name of the lifestyle that we discussed on the show at the beginning of the month? And this is a great way to ensure that your body is able to utilize the food that you eat as medicine. It is called the blank lifestyle.
It is the Mediterranean.
Oh my
lifestyle.
goodness, good job.
Yay.
Okay, she has been listening to the show.
I love it.
Okay, all right. Well, we got those first 3 questions correct. Bria, we're going to put you on hold, and we are going to bring in Annette. Hello,
Yes.
Annette, are you there?
I am here.
Wonderful, wonderful. So I know that our producer explained to you the rules of the game, so we'll just go ahead and jump right in. So the first question is, what is the correct order from greatest extent to least? Do these conditions affect the aging of your skin? Is it A, smoking, sun, pollution, B, pollution, smoking, sun, C, sun, smoking, pollution, or D, they all affect the skin the same?
I'm going to go with the answer C.
Okay, all right, good job. All right, people are listening to the show.
Well played.
Yeah, exactly. So, all right, next question. If we want to fix the skin, we should start by fixing A, your hormone levels, B, the health of your gut, C, your sugar intake, or D, your water intake.
I'm going to have to go with my pre and probiotics, starting with my gut.
Yes, good job. I like how we reason through it too, right? Love it. Okay, so the next question. What is the name of the lifestyle that we discussed on the show at the beginning of the month? That is a great way to ensure that your body is able to utilize the food you eat as medicine. It is called the blank lifestyle.
The Mediterranean diet.
Wow.
With Dr. Georgiana.
Yes, you're good. There you go. Good.
That show. I listened to that show.
Oh my gosh, I love it. Okay, all right. So you've got the first 3 questions right. So we have a tie. All right, so we're going to put you on hold, and we're going to bring in Natalia. All right, Natalia, are you there? Natalia, can you hear me?
Hi.
Oh,
yes, I can.
All right, wonderful. Okay, Natalia, so our producer explained to you the rules, so I'm going to go ahead and jump right into the questions. What is the correct order from greatest extent to least extent do these 3 conditions affect the aging of your skin? A, smoking, sun pollution, B, pollution, smoking, sun, C, sun, smoking, pollution, or D, they all affect the skin the same?
I'm going to go C.
Okay, good. Okay, got that
Good
right.
job. Hope
Okay.
that means you're wearing sunscreen.
Yes. All right, so the next question. If we want to fix the skin, we should start by fixing A, your hormone levels, B, the health of your gut, C, your sugar intake, or D, your water intake.
I'm going to go B, I think, the gut health one.
Okay, all right, that's great. Okay, the next question is, what is the name of the lifestyle that we discussed on the show at the beginning of the month that is a great way to ensure that your body is able to utilize the food you eat as medicine? It is called the blank lifestyle.
Oh gosh. Oh gosh.
Come on, Natalia. Come on, Natalia.
You got this, Natalia.
Healthy one.
Oh, that was a very good guess. The answer was actually Mediterranean lifestyle.
So close.
So close, so close. But yet, thank you so much for playing, and I hope you play again in the future with us. Thank you so much, Natalia.
And thanks for listening.
Yes, and thank you so much for listening.
Thanks for having me.
Thank you, honey. Okay. All right.
Bye.
Okay, bye, honey. All right, Bill, we got two. We got two left, and we need the tiebreaker. So we're going to bring in Bria. Bria, are you there? Bria, are you there?
I am.
All right, so it's you and one other person. All right, so here it is. Which of the following are produced in your gut? A, vitamin B12. B, biotin. C, serotonin. D, all of the above. Or E, none of the above.
These are great questions.
It was serotonin, biotin, and B12.
Perfect. Okay, all right. And okay, let me put you on hold. Let me go to our next contestant. Annette, are you there?
I'm here.
Okay, all right, here we go. Here's the tiebreaker. Which of the following are produced in your gut? Vitamin B12, biotin, serotonin. All of those are none of those.
I'm going to go with all of the above.
Wow. Okay, so we have a tie. We have a tie. So
double overtime.
Yeah. So basically, we're just going to give both of our winners a prize of their own. So stay with us. We'll be reaching out to you guys actually after the show
Good job, ladies.
Get you set up. Thank you so much. Thank you. All right, that was so fun, right? That was so fun.
That's a great question. Really good question.
Yeah, so again, it's so funny because the whole point of the show is to get people listening. The whole point of the show is to get people educated, and the fact that we were able to do it in that way.
Well, clearly you've done a great job. Everybody knew the answers.
I know.
Wow.
I know.
Great listeners.
Yes,
I'm
great
so impressed.
Great listeners. So, again, so let's wrap up with the show today, just ending on this note. There are many procedures that are out there that you can get for your skin, right? But what is most important, number one, is that you go in with the mental mindset of you understand that aging is a natural process that we go through. And the second thing that we need to understand is that, once we get the procedure done, that it is only enhancing what's already there. We're already beautiful. We're already vibrant. And
Absolutely.
so you're going to get the results that you want realistically, right? You're not going to look like somebody else. You're going to look like you.
You just brighter, enhanced.
Brighter and enhanced, right? So I want to thank everyone who tuned in to this week's segment of the Elle Show. Our store address and telephone number are on the website, roserxboutique.com. I'm your host, Dr. Nicole Eastman. I'm the pharmacist and owner of Rose Pharmacy and Boutique Apothecary. And a huge thank you to Suzie Baker, who is an esthetician at Lake Norman Skin and Laser, now owned by Renew Health and Wellness. You guys have an event coming up soon, right?
We sure do. We are doing a live demo event at Trilogy Lake Norman to showcase our new device. It's called Still Firm. It's a non-surgical facelift.
Wonderful.
Very fun.
Okay. All right. So, and if you missed any part of the show or want to see previous shows, you can go to WSIC News, WSIC News' Facebook page, and also we are on Apple Podcast and Spotify. Ladies, please block off your 3 to 4 p.m. time slot every Friday for the Elle Show, because I want this to be our happy hour. We are wrapping up our busy week together on a very uplifting note. Thank you again to our listeners, and I can't wait to see you guys next week. Have a wonderful weekend.
Bye-bye.
The new 105.9, 100.7 WSIC, Statesville, W2.